Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to always go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 60-year-old male with a 25 pack year smoking history is diagnosed with stage 1 COPD. He experiences mild shortness of breath during exertion and occasional morning cough with minimal sputum production. Spirometry shows an FEV1 of 85%. How should the nurse practitioner treat? Is it A, with the LAMA daily, B, inhaled corticosteroid, and a long acting beta agonist, C, a SABA as needed, or D, long term oxygen therapy? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, how should the nurse practitioner treat? And y'all know I tell you, if they're asking for a treatment, you need to run it back and look and see if they provided you with a diagnosis. If they have not provided you with the diagnosis, you need to run it back a step further and look at the assessment findings so that you're able to determine a diagnosis so you know how to treat. So this patient has been diagnosed with stage 1 COPD. So it has provided that with the question, letting us know that their FEV1 is 85%. So in stage 1, what are we doing to treat COPD? And remember, in that stage 1, C will be your best answer because you're going to use your short acting. You want to always make sure there's some type of rescue inhalant on board. So either a SABA or a SAMA. So a short acting beta agonist or a short acting muscarinic antagonist, right? And then it'll be PRN. And also if it's flu season, so if they tell you it's flu season or if they're telling you it's anywhere from October to March, because that is flu season, then you also want to give the flu vaccine. Question number two, a 78-year-old male with very severe COPD, stage 4, presents with significant dyspnea at rest and requires frequent hospitalization for exacerbations. He has a history of smoking, a 50 pack year history, and is currently on a SABA, a LABA, and an inhaled corticosteroid. His FEV1 is 28%, and he experiences symptoms despite optimized therapy. What is the most appropriate treatment strategy for this patient? Is it A, long term oxygen therapy? B, a SABA PRN, C, adding theophylline, or D, to start a systemic corticosteroid daily? Take a moment and tell me what you got. All right, so stem of the question here is, what is the most appropriate treatment strategy for this patient? So same thing, if they're asking you for a treatment, you want to run it back and see if they have provided you with a diagnosis. So here, this patient has very severe COPD, which is stage 4 of the COPD stages, right? Because stage 1 is mild, stage 2 is moderate, stage 3 is severe, and stage 4 is the very severe stage. So with this, in the very severe stage, this patient is already on a SABA, a LABA, and an inhaled corticosteroid. Remember, when we start with our short acting, we add a long acting by stage 3. Remember, when I was telling y'all on yesterday, my Britney's brilliance for that is we in stage 3 we give the 3 letters ICS for our inhaled corticosteroid. So stage 4, now you may need a long-term oxygen therapy if all of these things are not having success in treatment. And also remember, if you're doing long-term oxygen, they also at some point may warrant surgery. But again, that's not in our scope. So they will be referred out by the time that comes into play. All right, and lastly, question number 3. A 68-year-old female with a 40 pack year smoking history has been diagnosed with moderate COPD, stage 2. She experiences increasing dyspnea with physical activity and has 2 exacerbations over the past year. She currently takes a SABA PRN, and spirometry reveals an FEV1 of 65%. How should the nurse practitioner treat? Is it A, continue the SABA as needed only, B, initiate a LABA, C, initiate an inhaled corticosteroid, or D, start systemic corticosteroids for prevention? Take a moment and tell me what you have. So here, stem of the question states, how should the nurse practitioner treat? So same thing, we're looking to see if they provided us with a diagnosis, and if not, you want to look at the assessment findings. But here lets us know that the patient has been diagnosed with moderate COPD, which is stage 2. So remember, in stage 2, we're now increasing from just a short acting, which they're already on in stage 1, and we're going to add in a long acting. You also would have them with pulmonary rehab during this time. So the best answer here would be to initiate a LABA. They're already on the SABA short acting, like your albuterols, which is your rescue inhaler PRN. You want to add in now a LABA, like your salmeterol, to give something long acting at this time. And like I said, also refer for pulmonary rehab. And if it's flu season, of course, you want to get the flu vaccine. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently by watching videos on the go or any of your devices, my self-paced review course is also linked in the bio of this channel. It is designed for family and adult Gero reviewers. If you need to utilize any of my QBank options, they're linked in the bio of this channel. And then lastly, if you're looking to book any of my one-on-one sessions, I always say either call, text, or email because I offer a variety of one-on-one session types. So I prefer speaking with you to gauge what you truly need to make sure that you're booking the appropriate one-on-one session. But as always, y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.